What's going on, everyone? Happy Friday. Hopefully, everyone is doing well, staying safe, healthy, having a great day so far, and of course, testing negative for all those viruses. It is time now for the Friday edition of the Virus Update for Friday, July 25th, 2025. That's right. We're coming near the end of July. August is right around the corner. We are in the middle of the summer COVID wave here in the United States. And if you are new to my channel, welcome to my channel. This is where I talk about COVID, flu, and all those other viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed with what's going on with these viruses. That's what I do here on my channel each and every day. Want to stay informed? Subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. Already, we have a ton of things to get through today in the news department, and we do have some new data from the CDC. So we're probably just going to spend maybe just a brief amount of time on each story. We're not going to sit here and read every single story, but we're mainly going to read some headlines because some of them I think are rather interesting. So starting off over in Italy, where they are reporting 32 cases of West Nile virus amid spread of the mosquito-borne illness, and two of them those cases have resulted in deaths. So, yes, Italy, 32 cases of West Nile virus in 2025. This is a virus we have to keep a close eye on. You know, a lot of places are having more rain, and when you have a lot of rain, a lot of standing water, well, mosquitoes, they get worse, and unfortunately, the spread of West Nile virus does increase. All right, moving on. There will be a post this evening on my site, datareport.info, that it'll either be this evening or first thing tomorrow morning that will have the links to all the stories used in today's virus update because there's a lot of them. This is kind of a study. And this is actually some good news. SARS-CoV-2 detections in wastewater accurately predict illness within 1 week, study finds. So this is good news. But what this is saying is wastewater is accurately predicting and portraying what is going on with the community spread of COVID. And I assume other viruses are probably being accurately predicted as well, determining epidemiologic trends of virus spread and the burden of disease at the community level has become challenging. And yeah, it has in some cases because guess what? Funding for wastewater sites is dropping. The number of wastewater sites is dropping. The amount of data from wastewater sites is dropping. I mean, if we know this is accurate, why are we not having more wastewater sites to help predict what is going on in the local community? We should to help inform people of what's going on. Of course, you know the drill. They've been trying to hide COVID as much as possible. All right, studies suggest long COVID is more prevalent than previously thought. Uh, Jess posted this on X, at Meet Jess, account that we've shared many of times. We're not going to read the full story, but we're going to read this excerpt. And exposure to the virus that causes COVID-19 may lead to chronic health impacts that in some cases may become apparent only years later, according to new research in non-human primates led by Oregon Health and Science University. So there you go. The more we're finding out about this COVID virus, the worse things are. I mean, long COVID being more prevalent than previously thought, and problems that may not appear for a while down the line. All right, we do have some measles notes. California is dealing with some more measles cases, 3 more measles cases to be exact. First off, there are 2 cases in Tulare County, California, and it looks like these were both linked to people who were traveling outside of California. And the other one is in Los Angeles area. Public health officials have confirmed a case of measles in a traveler who passed through Los Angeles International Airport while infectious earlier this month. So, yes, measles cases yet again in California. Haven't heard much about California in a while. All right, moving on to this. Again, this is why we call it the virus update. We're talking about a lot of viruses today. Around 10 Team USA swimmers, quote, too sick to travel to Singapore with the rest of the team. A significant portion of Team USA came down with food poisoning at the team's pre-World Championship training camp. Yikes, that's not good whatsoever. And it's almost half of the members of the team are currently too sick to continue to travel. Yikes, that's not good. All right, moving on to this. Moving back to COVID news once again. And I believe we're going to be taking a look at the positivity rate this time for COVID in the United States. Yes, here we go. Breaking, the US CDC reports new 2025 SARS-2 positivity record. Highs in regions 4, 6, and 9. The highest since September. Region 4 and 6 sees the highest one-week spike since August and July of 2024. So which regions did we just say again? 4, 6, and 9. So if you live in the southeast, if you live in the mid-south, or if you live in 9, so California, Nevada, Arizona, New Mexico, Texas, Oklahoma, Arkansas, Louisiana, and all those Florida. Florida's been really bad for COVID lately. Georgia, Mississippi, portions of Alabama, Tennessee, Kentucky, North Carolina, South Carolina. Yeah, things are really going in the wrong direction for you at this time. U.S. national and 5 regions report the lowest positivity rate year over year of the entire pandemic. That's good news. Region 2 sees very sharp drop from last week. Extraordinary spike, which was revised up to 4.9. So region 2, that would be New York and New Jersey and Puerto Rico at this time actually saw a drop. So that's interesting. I believe that includes the Virgin Islands as well. So that's interesting. But you're going to see when we get to New York State in just a little bit that New York State on their state level data, yeah, they were starting to see things. All right. Then is the COVID info guy. Flu crisis. Flu hospitalizations in Queensland rose again last week. Yikes, this is not good because what happens in Australia now kind of portrays what we may be seeing for flu down the line as we get through our fall and winter. And you already know last year's flu season was really bad. In fact, I actually have something from this past flu season in the United States. Let's continue with this first. Yeah, they're now 13% higher in Queensland, the hospitalizations, than they were last year. A record 3,650 cases were reported from July 14th through 20th. So far in 2025, 91 people have died, but only 1.6 million or 26.8% of eligible Queensland people who live in Queenslanders, are vaccinated. Come on, we know the flu vaccine works. Yeah, but yet here we are. All right, Australian COVID-19 outbreaks in residential aged care facilities, July 24th, 2025. Active cases are down by 13.3%, or 1,065 cases total. Active outbreaks, 181, down by 8.5%. Resident cases, 777, that's down by 14.1%. Staff cases, 288, or down by 11.1%. Reported deaths in 2025. And get this, 335, and that is up by 14. Hey, people are still dying of COVID in those long-term and aged care facilities. Yeah, how about that? All right, let's go back to talking about flu here in the United States for a second. Data is still being found from this year's flu season. Would you believe it? More deaths have been found, more pediatric deaths have been found or have occurred. Yeah, we're not done 2025 yet. How about this? The pediatric death toll from flu for 2024-2025 continues to climb, with CDC informed of 5 more deaths last week. That brings this season's total pediatric deaths so far, to 266, which is only 22 fewer than during the 2009 H1N1 pandemic. So for all those people that say, data report never talked about the flu. COVID. All right, we talked about measles. We talked about an illness that's affecting the U.S. swim team. We talked about West Nile virus, and now we just talked about flu. And yes, flu is still a problem. And after all these weeks, there have now been yet 5 more pediatric flu deaths. I don't know when they first tested positive for flu, but for whatever reason, here we are in the middle of July. This is not normal, by the way, folks. We shouldn't be having flu deaths at this time of year. Here we are at July 25th, almost in August, and 5 more flu deaths have been reported for the 2024-2025 season. Is that the end of the flu deaths? I honestly don't know because we just randomly had more flu deaths today. All right, an observational point, since these are data filled out in the wild updates. I got something from out in the wild, so I've been coming here. If you do not know, maybe it's the first time you clicked on, all my videos are not from a car. We actually do data filled updates from home at a computer. I'm on vacation visiting my relatives. I'll be here until next Wednesday. Next Wednesday, I go home back to Philadelphia, Pennsylvania. It's about an 8 to 10 hour drive. I've been coming here since I was a kid. Now, there have been some missed years for various different reasons. The start of the pandemic was one of them. But the point being made is there are summer camps on this lake. Now, I'm staying at a camp, but it's not a summer camp. It's like a summer home type thing, but it's not like a summer camp where, kids go. Haven't done that since I was a kid. The point being is there's several of them on this lake. One of their activities is sailboating. Now, I've been watching them do sailboat for years and years. Never have I heard camp counselors, or should we say sailboating instructors, probably also counselors, have I heard them had to yell at the kids? Let me explain. Observation. I have been coming to the same place in Maine since I was a kid. There are multiple summer camps on the lake. There's one right across the lake. I do not recall in the pre-COVID times sailboating instructors yelling at the kids saying, "You're not listening." What am I referring to? Well, kids who have long COVID are having trouble listening and focusing. We're seeing in schools testing scores are down. Maybe some places they've started going back up. Honestly, I don't know. But we have seen several reports about things aren't going so well in schools. Well, this is bleeding over to summer camp as well. Do I know if these kids have long COVID? No. But one thing I do know is the majority of the population that does not take COVID seriously has had at least one case of COVID, if not more cases. And we do know the more times you get COVID, the higher your chances are of getting long COVID. So, I mean, put two and two together, it could be, maybe we know kids with long COVID. I just showed you the kids with long COVID section, or I should say kids with COVID section on my website the other day. We do know it causes them to lose their ability to focus and properly learn things. Therefore, it's frustrating if you're trying to teach someone and they can't focus and maybe they have long COVID. We don't know. We'll never know if these kids have long COVID. But you get my point. It's an observation of something I've never seen before. Focusing issue. It's affecting people of all ages. Just look at driving. Driving has gotten much more difficult. I'm seeing things I never thought I would see. I mean, yeah, driving used to be bad living in the city. I'm seeing it anywhere and everywhere now. It does not discriminate anymore. No matter where you go, you can see people that are just like, "Oh, okay, we were coming out of the grocery store today. I got to tell you about this." And mind you, this happened pre-times. I'm seeing it happen a lot more. A lady was putting her groceries in the car. She had a carton of milk. She was getting ready to drive off, and on her roof was the carton of milk. Like, oh, I forgot all about that. It's these little things. Yeah, some of them happened before. They're happening more frequently. Already, taking a look at the UK's weekly update, and we do see in the UK that things are trending in the wrong direction once again for COVID. Let's click on COVID-19. Hey, this website moves fast. And we can see COVID cases are up by 83 or 8.3% to the weekly number being 1,081. Deaths this week, 55 reported. That's up by 8. The healthcare number, I believe that's the same number from last week. I think that only updates once a month. The positivity rate for COVID is also going up once again. If we look at the positivity rates here, we can see back in April it went up a little bit, then it dropped a little bit, then it went up again, and we had a bigger drop in June, and yet again it's going up. The UK does this sometimes. We noticed this. I noticed this last summer. They were doing this as well. We probably won't be able to get this air quality map to load, but I have looked at it today. There's a lot of places dealing with problems. Canadian wildfires can problem. Tell you what, we'll come back to this moment. I just refreshed. Sometimes it takes a very long time for it to load up here. Whoa. Pinellas County, Florida. Check this out, folks. Not one, not two, not three, not four, 5, 6, 7, 8. 8 active sick person calls there right now. And let me tell you something. I did refresh wastewater scan today, and I took a look at it. Almost all the wastewater scan sites are high. There's maybe one or two that are medium. They are still high and continuing to rise in Florida. me tell you something. COVID is really bad in Florida. Look at this. Sick person here. Okay. Emergency, obviously. They didn't go non-emergency. They went emergency. A lunchtime at the hospital. 1 hour and 3 minutes. EMS delay, meaning it took a long time for them to get an ambulance out to them. That is ridiculous. And wow, Florida. Pinellas County, Florida is near St. Petersburg, Clearwater, Tampa Bay area. Wow, this is yikes. That's really bad. Just not good. Wow, you're waiting an hour just to even get to a bed, just to get out of the ambulance. Oh my. All right, let's take a look at what's going on in Philadelphia. And I got news for you. Southeast Pennsylvania is really starting to go upward for COVID. I'm watching the EMS calls. Okay, Wednesday they had 797. Yesterday was 821. But in the suburbs, the CADs, and I can see the types of calls. I'm respiratory difficulty, and I'm seeing sick person calls go up big time now. And we do know Warminster, Pennsylvania, that's in Bucks County, has seen a significant increase for COVID in wastewater. Yeah, take a look at this. Wow. Yeah, Montgomery County, 17 calls right now. I'm seeing cardiac arrest in Upper Salford. I'm seeing 1, 2, 3 respiratory emergency calls. Remember, we haven't been seeing many of them lately. And they are starting to show up. Cardiac emergency. Hey, there have been cases of people having heart attacks and cardiac arrest while positive for COVID. And who knows, it could be for other reasons as well. Taking a look at the CAD here for Chester County. Yeah, I'm seeing 1, 2, 3 sick person calls. I'm seeing respiratory call at least once. I'm seeing a lot of calls here. Wow. Yeah, things are really getting busy right now, whether it's COVID or not. The EMS, and as you saw, Florida is really busy as well. I wish I could show you the Maryland one, but that Maryland site, even when I'm at home on a stable internet connection on my high-power computer, that site is so slow sometimes. I don't know, but yeah, things are really bad. Let's take a look at Bucks County real quickly. A 10 EMS incidents there. I mean, yeah, things are bad right now. The hospitals, they are getting busy once again. We haven't looked at our hospital tracking in a while because I don't want to take chances of load that. But take a look here. New York State, the cases are starting to go up for COVID, 514. Yesterday, we missed New York City day, 572 cases. That was a significant rise from last week. Things are starting to go upward. Now, mind you, we're not as high as last summer, but the point is things are trending in the wrong direction. And we're also going to take a look at the hospitalizations here. Here they are. They've gone up this week. 264 people in the hospital, COVID related, or so it says on the count. And take a look at this. Epidemic status is growing or likely growing in a lot of places. Surprisingly, has not changed in California, Washington, Oregon, and several other states. Florida has not changed as well, but I can tell you right now, Florida is just swimming in COVID. And hey, COVID's likely growing in Alaska and Hawaii. Look at this. It is now growing in North Carolina, South Carolina, Georgia, Texas, Oklahoma, Utah, Missouri, Illinois, Indiana, Ohio, likely growing in New Hampshire, which is not far from here, likely growing in New York State, Pennsylvania, Virginia, Tennessee, also Arkansas, Alabama, Louisiana, Michigan, Wisconsin, Minnesota, Iowa, and South Dakota. So yes, things are trending in the wrong direction in many different places. And finally, taking a look at the emergency department visits, we can see here the emergency department visits continue to trend upward, but we're not seeing them go rapidly up yet. They're just gradually going upward. But I think as more states start to join the party, I mean, New York has just gotten going. Here in Maine, things are not really going up just yet. Once more states join this, I want to call it summer COVID party because people are doing whatever they want. I mean, I would hate the fact, let me tell you something. If I had to come up here to Maine and I didn't stay where I'm staying, and I stayed at a public place, where you're surrounded by a lot of people, yeah, it would be a totally different story. I'm very lucky that I'm here with relatives, or else, trust me, folks, I would not be here right now. I would be at home doing my usual, going out to work, coming back home, making these videos. Get the point? Alrighty, folks, that does it for the Friday edition of the Virus Update. Sorry if I rambled a lot today, but there was a lot of things to talk about with these various different stories. We'll have another update again tomorrow. Anything we missed today, anything that pops up, and whatever else I find. Give this video a thumbs up if you like it. If you're new, subscribe down below. Hit that notification bell. Share this video with anyone you know. And of course, leave any thoughts that come to mind in a comment down below. I will see you again next time. Until I see you again next time, stay safe. Have a fantastic weekend, everyone. Thanks for watching.